Colon Cancer by Charity Davis for Pathophysiology for Public Health. For this presentation, my agenda is as follows. Colon cancer breakdown, side effects of colon cancer, background rationale, public health/population, future research drug trials, recognition strategies, and the closing and conclusion. Colon cancer breakdown. What is colon cancer? Colon cancer is the third most common cancer worldwide. It is the second leading cause of cancer-related deaths in the United States and the fourth leading cause of cancer-related deaths. It's actually the number 2 cause of death in women, number 1 being breast cancer. Mortality in 2020, there were 1.9 million new cases and more than 930,000 deaths globally. It's an economic burden. Healthcare costs in the United States, colorectal cancer generated 24.3 billion in medical spending in 2020, which is 11.6% of all cancer treatment costs combined. Productivity loss. The disease also leads to significant productivity losses due to illnesses and premature deaths. Prevention screenings. Regular screenings such as colonoscopies are crucial for early detection. There are other ways to be screened as well, which I'll discuss later in the PowerPoint. There are lifestyle factors. These can be a number of reasons why someone would get colon cancer. Some of them have to do with processed meats, not eating enough fruits and vegetables, having this lifestyle where you set mostly and are not as active. Obesity, smoking, and excessive alcohol have all been linked to colon cancer, but there are many, many more factors that you'll see later on. The symptoms of colorectal or colon cancer. Common symptoms include a change in bowel habits, blood in the stool, abdominal pain, unexplained weight loss, and fatigue. However, there are different symptoms depending on the person, and not everyone is the same with the symptoms. Some people don't lose weight. Some people just have abdominal pain. Some people have been linked to just having blood in their stool or having a low anemia blood count result on their labs, which leads to them looking for where they're bleeding, which is internal. There are some patients that don't know that it's colon cancer, of course, based off their symptoms. So that's why it's so important to get screened. And they recommend by the age of 50, well, 50 or older to be screened every 10 years unless there's symptoms or something wrong. But nowadays, it's a lot less. A lot of people are getting it at a younger age and dying at a younger age from it. So it's very important to check your symptoms and, if when in doubt, always ask and then also get screened. So what are the risk factors for getting colon cancer? Like I stated in the previous slide, usually and primarily it's in older people or older patients, 50 years or older, which I don't really consider very old because I'm 48. But that is primarily what they suggest. However, like I said, nowadays it's a lot less. So some doctors are recommending if you have any symptoms to get checked earlier than 50 years old. Also, their family history of having colon cancer. Anyone that had colon cancer under the age of 60, you're more than likely have a higher chance of getting colon cancer. So if anyone in your immediate family, like mother, father, had it at under age 60, you should definitely be checked or screened. History of inflammatory bowel disease or ulcerative colitis Also, they said that IBS, patients who have complained of having IBS in the past have also had more of a link to colon cancer. Your dietary history, so processed meats, not having enough fiber, not eating correctly, not enough fruits and vegetables, things like that. Smoking contributes to it as a risk factor. Alcohol consumption has been definitely linked to colon cancer and actually can create more problems with colon cancer, especially if it metastasizes to the liver. So alcohol consumption is very dangerous. Increased BMI, so that means that your body mass index is higher than it should be. That is also a precursor and also something that has been linked to colon cancer. And then genetic conditions. There are certain genetic conditions that I discovered. There's two particular type of genetic conditions that are autoimmune deficient conditions that if your parents had them, more than likely you are more prone to having colon cancer. So what is the background rationale? Colon cancer often arises sporadically linked to factors like age, race, diet, and conditions. Also, inflammatory bowel disease or IBS, like I stated in the previous slide, has been a background rationale. And also hereditary cases, the primary culprits are Lynch syndrome and genetic polyposis syndromes. These are the syndromes that I stated. If they're in your family, you have more of a link to or being more predisposed to colon cancer. Screening colonoscopy plays a vital role in detecting and also early stage lesions. The more early you get checked for colon cancer, the better your chances are if you do get colon cancer of surviving. Colon cancer develops from certain polyps or growths in the inner lining of your colon. Those polyps or growths, if they're undetected or not known that you have them, can grow and they can metastasize and spread to other organs. Okay, so what are the stages of colon cancer? The very first stage, which is stage 0, actually, is the earliest stage, and it means that the growth it has not grown beyond the mucosa. So it's like very beginning stages. It's not even an actual stage. It's like a pre-stage, if you will. Stage 1 indicates the cancer has grown into the inner layer of the colon, which there's a picture here showing you each stage and what it would look like on the inside. Um, and it is coiled the mucosa to the next layer of the colon called the submucosa. The second stage is the disease is a little bit more advanced in this stage, more advanced than stage 1, and has grown beyond the mucosa and the submucosa of the colon. So it has grown past both mucosas at that point. The third stage, the tumor has grown or through the muscular layers of the colon and found in the lymph nodes itself. So lymph nodes, once it's in the lymph nodes, it can spread to other lymph nodes in your body. Um, so we have a lot of lymph nodes in our body. So once the cancer has spread to the lymph nodes, it's really dangerous because it can spread to other lymph nodes and cause more problems. Number 4, stage 4 is the most advanced stage of colon cancer, which indicates that cancer has spread to distant sites like the liver and the lungs. So once it came out of the area that it's in and metastasized past the lymph and blood vessels, it then goes to the next um, body part, which is the liver. The liver is the first organ in which it usually can go to. However, it can also travel different ways through different blood vessels and things of that nature to go to different body parts, like the lungs or, other ones as well. So, but the liver is primarily the one that would be the first organ affected after it starts to metastasize. I found these public health and population numbers to be quite interesting and actually really alarming. Um, as I stated previously, some numbers I kind of ran off earlier in the slides, but the 152,810 estimated adults diagnosed with colorectal cancer in 2024, this year alone, and this year is not even over with. That is an astounding number of people with a diagnosis. 53,010 estimated deaths from colorectal cancer in 2024. I myself lost a friend that I grew up with, and I knew her most of my life. And I just went to her funeral a couple months ago, and she died from colon cancer. And it was really sad and hard, especially the fact that she was my age and I knew her and we were friends. And it was very quick once she was diagnosed. It was like less than a year that she passed away. So, and it says 1 in 3 adults age 45 plus not screened as recommended. So they're now stating to go earlier than 50 years old, with the incline of numbers staggering like this. They're starting to see a lot less older patients and a lot more younger patients starting to come down with colon cancer. So if you have any symptoms at all, please go get checked. 1.54 million men and women alive in the US with a history of colorectal cancer, meaning that they had cancer or they're living with cancer. So these numbers, they are also generated on this long-term trends graph I put here on the bottom and the website. And there's also a link there on the top of my reference where you can go to see this information. So the future of colon cancer, there's been a lot of sustainable information and things that have been helping patients, but there's um, a lot of emphasis on early detection, minimally invasive surgery. Surgeons have developed new methods for colon cancer treatments, which is astounding. They have new ways of finding out if you have colon cancer. Um, just like with the colonoscopy, they have the original colonoscopy, but they also now have a virtual colonoscopy that they do by CT, which I found was very interesting. They also have more targeted therapies or regimens, medications. This medication called Vextibix is a brand new medication that just got FDA approved. This gentleman on the right, Marwin Fakai, MD, he is at City of Hope, and he is a doctor that has studied gastrointestinal cancer, and he works in the gastrointestinal cancer program, and he gives his patients this medication, and it seems to be helping them a lot. So that's groundbreaking and very uplifting to know that they have found certain medications that can help some patients, especially even in stage 4, which I found to be very interesting that even in stage 4 they were able to get some kind of help or relief with these medications. So that is uplifting. And also immunotherapy. They have inhibitors and antibodies that they have used for and to treat colon cancer, which I found very interesting. There's also on this colorectalcancer.org a lot of different companies and places that help and fund and research and, are looking for answers. So I believe that the future is going to be a little bit more brighter because we have more technology. And now that we know that we're not just looking at elderly patients for colon cancer, we're looking at all patients. I think that they're going to be putting more of an emphasis on earlier detection and better methods of finding the colon cancer sooner, which is going to save a lot of lives. I went down this path of finding resources. And it's really interesting because there seems to be a lot of resources. There's even groups that people can join of different types of groups surrounding colon cancer. They have loved ones that lost people from colon cancer groups. They have groups of people who just got diagnosed. They have groups of people that are looking for different regimens and different doctors and different things. I read a story about a 48-year-old man that had gotten cancer, colon cancer, and he was stage 4, and he had joined one of these support groups online, and they gave a name of a doctor that is specializing in advanced treatments. And he is a doctor that believes in um, the ability to actually do surgery on the liver when it has metastasized to the liver. And he saved his life, which many doctors, once it metastasized to the liver, they don't want to operate. But this doctor does. So through that group that he joined online, for support, he found that doctor and now he's still alive. So I thought that was really interesting. There's also events and webinars. American Cancer Society has a lot of information and resources for patients. And then I just found this slide through a YouTube, a PowerPoint talking about colon cancer, and I thought it was really interesting. There was a lot of information on it, so I included that. And then the YouTube link is right there under the resources tab. So for recognition strategies, as discussed throughout the PowerPoint, colonoscopy is the gold standard for detecting colorectal cancer and removing precancerous polyps. It also allows for removal of polyps during the procedure, which can prevent cancer from developing. I did do research on the polyps, and there are different types of polyps as far as how they're structured and how they are shaped, and it can create some issues and problems during the colonoscopy. If they're shaped a certain way, they might not be able to detect if they're getting all of it out or not. So there are different types of shapes and structures of these polyps, which can make it quite difficult. They also do stool-based tests like the FIT test. It's a fecal test that you put your stool on and you turn it into the lab and they run it to see if there's any blood in your stool or anything like that. There's also a flexible sigmoidoscopy. This looks at the lower part of your colon and rectum, not up the whole colon as the colonoscopy does. But it can be helpful as well, especially if you're dealing with rectum cancer. And then the virtual colonoscopy that I talked about earlier is so cool. It's the interior view of the colon, like a CT scan. And then genetic testing to see if there is any genetic syndromes like Lynch syndrome, et cetera, that can help in early detection of colon cancer. So the conclusion for me is that, there's been such a spike of colon cancer. And regardless of the reasons why, prevention is definitely the key. Being preventative and proactive, getting screenings is so crucial. There's a lot of fear in getting colonoscopies. However, it's a minimal procedure that can save your life. And in my research and speaking to families, those who have died from colon cancer, the time is short and life is threatened. It can take your life from you very quickly, especially if you have not been diagnosed and it now has metastasized. Some people have been misdiagnosed with other issues due to symptoms that mimic the symptoms of colon cancer. That's why testing is so crucial and having the knowledge is very important. More awareness is needed and can potentially save so many lives. If it were just one thing to be left with, it is if you're in doubt and you're having symptoms and you feel like something's wrong, listen to your heart, listen to yourself, and go get checked. Um, this hits me a little personally, but I've been ongoing with some issues myself. And I've been to the ER like 4 or 5 times recently with abdominal pain and particularly right upper quadrant abdominal pain, which is indicative of colon cancer when it has metastasized to the liver. Not really putting that on myself, but I am getting checked to have a colonoscopy on October 31st, which is Halloween. But it's very important that I do get checked. you know, best case scenario, I don't have colon cancer and I don't have anything wrong and I went and got checked and I'm good to go for 10 years. Worst case scenario, I do have colon cancer and I need to get treated. So either way it goes, it's very important. And I also included a picture here on colorectal cancer by the numbers again, just some stats. And if you know anyone who is going through these issues, please encourage them to get checked. I know for me, my family, my father and my mother refused to get checked for colon cancer. They refused to get a colonoscopy. And so a lot of men in particular don't want to have it done. And it's understandable, but at the same time, it's the best way to see what's going on. So, anyways, I believe that people I lost would still be here if they would have had more prevention in their care.